Yellow fever, a disease prevalent in rural tropical parts of the world, namely Africa and South America. This is a deadly positive strand virus, killing an estimated 10 to 15% of all people it infects. Those who recover have no severe organ damage. The morbidity rate overall is about 2.2%, but 90% of the deaths that occur are from Africa. It carries an envelope while in transmission in a vector, but sheds it to start the process of infecting a host. It can be found in the tropics in Africa and South America, but is more commonly found in the rural areas where there is limited health care. It is slowly spreading to cities due to urbanization. There is an estimated 200,000 new cases a year. Yellow fever isn't really passed from human to human. It needs a vector. That vector is the flavivirus genus of mosquitoes, which is why it is an endemic in the tropics. It primarily affects humans and primates, and it spreads from one to the other, as well as human to human or primate to primate through mosquito bites. If a mosquito bites an animal with yellow fever, it picks it up and then becomes a carrier, infecting everything else it bites. Infection starts 3 to 6 days after incubation and may present itself simply as headaches, fever, vomiting, and simple flu-like symptoms. In most of these cases, it goes away after 3 or so days. In some cases, however, symptoms can be very severe. It infects the body by first entering the bloodstream. Then the virus waits to be phagocytized by the macrophage. When this happens, the virus sheds its envelope to prevent further digestion and waits until the macrophage carries it back to the lymph nodes. The macrophage host is lysed, and the virus rushes out to infect the other macrophages present. During this, some of the virus is carried to the liver, where it infects Kupffer cells, specialized macrophages present in the liver, among other places. This is when symptoms begin in earnest. Normal function is disrupted, leading to jaundice, which is the yellowing of the skin and eyes, giving the yellow fever its name. As liver damage progresses, flu-like symptoms may appear, then eventually hemorrhaging through the body, very similar to the effects of Ebola. We have a hormonal response to the infection, but hospitalization is recommended. There is no known cure consistent with other hemorrhagic viruses. Treatment is composed of patient comfort and pain relief in the hopes that they can fight the disease off on their own. Aspirin is not recommended in treatment as it is a blood thinner and can have disastrous effects to a patient with internal bleeding. The best response is to just avoid getting the virus with tools like mosquito nets, using insecticides in standing water, and getting vaccines which mitigate the danger posed. If you want to prevent an outbreak, get the vaccine. It's for your family's sake. To prevent outbreaks, a 60 to 80% vaccine coverage is needed, which is enough of a reason to get the shot, unless you want to see your family and neighbors bleeding out on the floor out of every orifice.